and behind the humerus in here, here's heart channel, and before in here is lung channel, and back is liver channel. It looks like three. Yeah. They connect in here. Connect some point can connect to the kidney, but not always. Okay. But it's very ideal. Is usually it's the middle one is heart channel. The central one or middle or central one is heart channel. Okay. Okay. Yeah. In the middle side is more okay. Then in the another side is different. Okay. Yeah. Yeah. You from the thigh, you know. Okay. Yeah. Yeah. So it's but basically middle one, central one always is a heart channel. Okay. Okay. Okay, we show you this one how to insert needle. Come on.
Okay, our model. We're gonna show demonstration in needle. 要跑还是就一直这样？
啊？
要跑吗？
不要吵，不要吵。Demo leg, demo thigh, demo thigh. It's all in left hand. Why? If you have a baby, we'll feed the milk. This one with a bottle, right hand, skill hand. This hand with what? The head, baby head. Which one more heavy? When you're cooking, which hand with a spade? Which hand with a wok? Which one is more hard, more heavy? Just like this way. You understand this one, so sometimes you can explain to your patients. Your patient will happy to hear about this one. Okay? Yeah. Okay. Because I don't want to at the same time give the model too many needles, so one area, show you once. Okay. So the treatment is in here. You understand? Okay. You can find. Okay. We don't need to say. And it's a very important. Sometimes it's good for bulging disc. Bulging disc is very good. Okay. Yesterday we mentioned about this user here, Lin Jixian. I remember the name. My brother, my 师兄. Okay. He learned the acupuncture from Master Tong, and he moved to the Los Angeles very early. He already passed away. Okay. Lin Jixian, he very used to treat the bulging disc in USA, in Los Angeles, but he already passed away. Okay. His father was the congressman. Okay. This is Master Tong's clinical the cases. Okay. Hand weakness, upper straight yellows. Okay. Plus kidney gate, bilaterally condition cured in night treatment. See, it's night treatment. Okay. It's not one or two. Sometimes still need time. Okay. Don't think everybody coming Master Tong is one needle, everything done. No, not like this way. It's too easy. He cannot make money. And you use this one, every patient coming one time, you cannot get enough money to survive. Okay. Okay. And imaginate man with the tuberculosis. Okay, was cured by Master Tong. Okay. See here, give you idea. The tuberculosis treated by Master Tong. And this guy treatment except use a needle, and he still use the peanut soup. Peanut soup. Use peanut soup help. Okay. And the Baiji. You know Baiji? Baiji and the peanut soup together treat this one. Okay. This Master Tong treat the lung disease use if he uses something is use the Baiji and the peanut soup together. Okay. He read the palm, found the dark greenish spot in the area of the liver spleen channel. The Master Tong needle the upper straight yellow group to relieve his shoulder pain. Okay, so this one is to give you an idea. So here still can treat the shoulder pain, but this one is liver condition. Okay, the other use this one cannot work. So you know, some people know the frozen shoulder. You always like use the kidney gate, and another one it look like a ST36, right? Dr. Yang like you use this one, but some work, some not work. It's because the condition different. Okay, and a man from political military college and lumbar disc herniation, which pinch nerve, okay, nerve root, and to have a severe both legs pain. Master Tang used the upper three yellow group and liver channel and open kidney channel to treat him. Sometimes add the open heaven, okay, and open heart channel to treat this one. Actually, here is one very important idea, okay. It's sometimes disc problem, you still need to treat the heart. If they still have heart condition in there or kidney condition in there, you should put together, okay. So he's not only, you say, okay, you could say, okay, the condition, you find first the root cause, you use the upper three yellows, and you still have another problem, heart and kidney. So you insert needle in there, right? We just keep the idea, okay? So skin itching. A lady's major complaint was the skin reddish and itching from the both dorsal feet to leg. Matang said this condition belongs to the liver and the kidney, and the stick bright yellow liver channel of the open kidney and the kidney channel and treat the disease. Okay, so this is just give you an idea. Just your diagnosis to understand is the liver or the kidney is very easy. In here, give me one answer. Okay, usually 5 zang, if you take pulse in where? Lung in right twin, right? And in right twin, it should be the normal lung pulse should be floating, right? More floating, okay. And the heart in left in here, right? And what is more hong, more big one, right? And the same thing, you try to find the spleen and the liver. Liver is a string, okay? And the spleen look like a more what we call it more loose, okay? And then the kidney, okay? Kidney channel, if you very easy feeling the floating and the large, sometimes it's no good. The kidney is not good enough. Right side is a possible, we call it the Mingmen fire, too much. Mingmen fire, too much, too exalted, okay? So be careful, okay? Okay. This one is the liver, then we'll go to the heart, okay? Heart is harmony, all pain disease with itching and the soul, heat, okay? The heart, okay? This is a point, okay? Now, I think this picture, I didn't do good things, okay? Actually, because the bone is goes this way, mostly these 3 points should just on the bone. It should be on the bone, okay? The picture, because recently I study more, I think I found something, okay? Later I show you, okay?
Do you mean they should curve with the body, with the bone? The point
Yeah, you just go the bone. In here, you just follow the bone. Follow the bone, yeah, more easy, okay? And in here is still give you heart pulse deficiency. The other things you can see in the book or in the notes. The most important I give you in here, 5 zang channel is primary heart channel, and heart pulse deficiency and the forceless. You find heart pulse, okay? It's in the left twin, okay? It's deficiency and the forceless. No It's you cannot feeling very strong, okay? And the indication, pericardial heart mouth, okay, opening pen in here, this area, okay? So Master Tong treat many cases is a problem in here, he treat like this way. Actually, you know, sometimes you feel uncomfortable in here is what kind of disease? The GERD. Yeah, reflux, like acid reflux. You can use this treat too, okay? Here's a Master Tong, all the Master Tongs, the cases, okay? And the joint, the rheumatalgia, talgia, 2 hands, 2 legs, and 2 knee pain, open gate, and the open mountain, okay? I give you an idea. My experience, okay, you should feel the tender in here. You should feel the tender in this area, okay? You should feel the tender in here because the muscle in here can directly touch what? Your kneecap. Your kneecap. So the muscle in here is possible hurt. So you can use the point in here, okay? Same thing, I treated a knee problem, okay? Some people, it's just in the medial side have hurt. And you can find it in 3 yellow, here's hurt. You find a tender point at this one. And this one is very good, okay? Master Tong said for all heart channel disease, needling shoulder center and the open heaven will produce a special effect, okay? That means one in here, one in here. One is in here. This one later we'll talk about, okay? And gastrosia, okay, open heaven. I just mentioned about this one, okay? Reinforce the mother tongue, okay, to treat the deficiency spleen condition. This look like a reflux, okay? Martin said joint pertains to the heart. For any joint condition, look for heart channel point in order to treat, okay? Actually, this one, my study is still cold condition. If it's still a cold condition, use this one, it's okay. Not cold condition, cannot get good result. Okay, we show. Come on.
So the heart points treat the joints if it's a cold condition.
Cold, yeah, below fire, yeah, warm joint, yeah. Yeah, we only use 1 point, okay? Okay, this is, we call it 5, okay? Here is 3, another 2 is in here, and you will feeling the muscle in here. Bounce is very good. Bounce is very good, okay? Actually, sometimes you still can feeling a little depression in here, but not easy, okay? This one, because the bone is under in here. So see, I still use my hand, give pressure, and my needle put in here, and go down. Okay, just like this way. It's very quick, okay? But your left hand is very important because after your last one, your muscle bounce in there, and the needle sometimes more easy in. And the patient won't feel too hurt, okay? And now I give you another one. 再加一针. Now I give you is 4 horses. Later we will mention about it, but I just show you in here, okay? And 4 horses, okay? 4 horses, this group, okay? Most people will say it's from in here, and the major 3.5 cun. Try to find the point, right? It's okay. Yeah, it's here. You don't need no more. From here, lateral side, right? And for 3.5 cun to here, right? Now I use another way. You try to feel in the bone. Okay, here's bone in here, femur. Okay, along the bone, just beside the bone, is the needle. Just beside the bone is the needle, more easy. And then in this one, it's your hand. is try to pull the muscle away the bone. Then be careful, hair pull. Don't insert needle to the hair pull. If you insert needle to hair pull, the patient may maybe jump. Very hurt. Okay, be careful. Okay, and you insert needle in here. Okay, go. See, very easy. You don't need. Okay, and be careful in here. You will see what I insert needle is only use these 2 fingers, not wrist. It's your hand. Very important. If you insert needle, use your hand like this way, no good. Insert needle, only use fingers, not your wrist, not your elbow, not everything in here. Oh, concentration. Okay? You'll see, right? Okay? Yeah, we take away, okay? That'll give you an idea, okay? You use this way, you can do. Because in old book, in 1964, the 4 horse have 2 positions. 4 horse, the first position is in AAO 1, 2, 3, 5 寸 lateral, 5 寸 lateral from the AAO 1 to AAO 3, 5 分 0.5 寸, okay, in here, okay. So this one is just beside the bone. Yeah, then sometimes in here, sometimes it's 3.5, it look like more close to here. But in my experience, okay, if the patient's skin problem is more hot, you're more close to bone. If not more hot, you're a little away. Little away is okay. This is still dependent condition, okay. So if patient coming, look at the fire condition is a lot, you just more close to bone. It's better. Okay, thank you. And in 1964 book, okay, the 4 horses is means. The 4 horses, now the four horses name, and Master Tong say it's from the AAO1 to AAO3 and the 5 fin lateral side. And another one, now the 4 horses, in that time they say the 4 horses lateral. The 4 horses lateral point. Okay, so a little away. So this look like these horses. This look like a little, look like one area in here. Okay, but after 1968, it's just fixed in now the 4 horses the point in here. Okay. Okay. Now we go to the spring disharmony. Okay. Actually, this one you will see. Okay. In here is look like because position. Actually, your needle insert needle is go to this between these 2 bones. The needle tip is go to this between these 2 bones. Okay. So the channel in here, spring channel, then hard branch channel and the long branch channel in here. Okay, but the major one is the spring channel. This is Tong's acupuncture. Okay, so he treat the spring condition. If a spring condition is mostly he use the right side. I don't know why. Okay, don't ask me why only use right side. Just experience is mostly use the right side more for spring condition. Okay, the pose is the same thing. Deficiency and the pose is in the right guan, in right guan. Okay, 3-layer group, okay, indication a lot, okay, you get hypothyroid disease. And here I just give you idea, okay, here delete something. Delete is Master Tong oral delete. After he published the 1973 book, one day he just with disciples in a clinic, he just say, okay, I give you idea, and or something we delete, something we add, and add what is which was added by Master Tong's oral modification, added spleen inflammation, pain, enlargement disease, okay, splenectosis, okay, breast cancer, sputum, distension, pain. This is all just only in here. Spring disease only stick 3 needle to right side. Okay. Trigeminal pain. The trigeminal pain not including in right side. Okay, it's depend right side go to left side go to right side. Okay. This is marathon end. It's not somebody's experiences. Somebody say this is his experience. No, this is oral the modification, and not my book, not my 1973 book. Even the Mr. Yuan, the assistant editor of 1973, his book is the same thing. Okay, so I recently put some cases in there, something in there to mention about this thing. This is ad. Okay, needle technique. All 3 points is go to the go to the between. I will give you the fibula and the tibia bone beside in there, inside in here. Please. And here, see, in here use the 回马 technique, not 倒马. 回 have a turning place. Okay, come. 辛苦一下啊！你喜欢右脚啊？来坐吧，不要站，不要站。Yeah. You know, in the old time, there is not only one. It's not only 4 points. Actually, in the old one, in 1964, say the 3 layers in here has 4 points, but one is 2 Hz, so don't use one. 2 Hz one is this one. This one 2 Hz. Okay, so just go to more 2 寸 in here. Okay, so you will find and the bone in here. The bone in here. Here's the middle. You can depression, right? You can find. Okay, if you want this needle is more close to the bone to here, you can pull to here. Pull in the needle. That's it. Okay, just like this way. Okay, if you want to close to the your fibula, tibia, you go to there. Fibula go to here. It's the same thing. It's very easy. But most important, the needle tip is between these 2 bones. Okay, it's more easy. Okay. Okay. Talk no. 讲实话 Not too painful, right? No feeling?
No feeling.
You can walk to there. Okay, thank you. This all the clinical cases of master tongue is one is 1964, Chengdu Dr. Chen's notes. Another one is my notes. I still left some notes, not flood only take away most of my notes, not every note. Actually, my ex-wife is a master tongue's disciple too. Okay, yeah. But she now is a master of the India religion. So he every year went to the Himalaya. Okay, went to there, 1 month in there. Okay, now he just in China, in Taiwan, and he's a master. He already get a master degree. Okay. Okay. Master tongue's clinical cases, okay. Master tongue's cases, mouth deviation to left side, be careful. Here, very important, okay. If you have the facial problem, the patient coming, if you at this point, okay, be careful. Mouth deviate to left side. 7706, 7707, okay. And the AA 2.25 central 9 miles 到嘛, okay. 3 days later, right 7 fast, okay. Okay, here give you idea. So if you deviation to the right side, you insert needle to right side, not left side. Why? Oh, no. You know, okay, if you have a facial paralysis problem, okay, if you have this one, okay, your deviation to the right side, you're hurting left side or right side. If your deviation to the right side, the facial problem is in right side or left side? Left side. Left side weakness. So right side muscle pull to here. Okay. Then your insert needle to another side is try to give you the 7 to right side. In this case, okay, to right side is try to even. Okay. Right, try to enforce the muscle force. Go to here. I give you an idea. The 7 fast in here. Okay, it look like a traditional point. Okay. I don't know you will do or not do. Okay. I was in Taiwan. Show some student. This one I show myself. I insert needle in here. I just feeding my muscle division to this side. I just withdraw needle immediately. Okay, so be careful. Okay, so this one is the same thing. Is try to balance the muscle. So the treatment is the same side. Look like the same deviation side is not your hurt side. Actually your problem in your another side, in left side. So you treat the right side to treat the left side, and you use another side is to try to enforce the force, keep the force muscle more powerful, strengthen the muscle, okay? A man had a bone stuck in his throat for 2 days. After master tongue needle the 3-layer group, he was able to swallow the bone immediately, okay? Mr. Lin Ju-chu, the first disciple said, if needling 3 layers group doesn't work, add beside 3 mouths, needle beside 3 mouths vertically vertically to the tip, to the needle tip towards to the 3 layer. It's go to this way, okay? It's go to this way, okay? Because this point, okay, 17.22 look like okay, GB 34, okay. So it's look like a problem like this way. Tip is different, okay. Okay, here just give you an idea. The tip go to where? Okay, direction towards to the crevice, okay, between the fibula and tibia. So after we palpate here, you should feeding, okay. Actually, when I teach the tongue sacrum in Taiwan, always because in Taiwan it's more easy, okay. We can directly insert needle to the student, okay. We don't need a model. We insert needle to you. In USA, sometimes not good enough, okay. Need your wave, right? Sign the waiver, okay. Model for master tongue treated esophageal cancer with a 3-layer group. He said it is hard to treat cancer because it is difficult to determine how cancer moves through the channels. So you cannot make sure which channel affect. It's very hard. But he treated the esophageal, he still used the 3-layer, okay, treat, okay. It should be, he think, still spring. And I'll give you one idea. If I treat any cancer disease patient, the first things I just protect their middle, spleen and the stomach. Spleen, stomach. It's look like we protect the qi, the middle qi. And if you have the middle qi, then you can against the cancer cell. Okay, give you one idea. If the patient already go to the for the surgery, already for the chemo or anything, even you use herbs, don't use the kill cancerous herbs. Because surgery already hurt a lot. You don't need to kill. You need to protect the middle qi and let here here inside we call it is 有正气 ，OK， 有正气 and that 有正气恢复 and recovery 有正气 to treat the cancer, not still to kill the cancer cells, OK. Because you use a lot, see, surgery, chemo, radiation, is kill a lot, right? You still use to kill, and the patient will more weak, like this way. Well, this is my thinking way, okay? Right or no right, and you make a decision, okay? This is my experience, okay? We treat the other one is better, okay? Okay, lung disharmony. Now we already show you the 4 horses, okay? It's all disease with a dampness up qi, and the resulting the chest pressure, we can use the lung, this one, just in here. Four horses group, okay? The channel, be careful. Primary is lung channel, and the liver brain channel. Actually, in here, the skin problem in in master tongue thinking way is skin problem always is lung and the liver channel fighting each other. If lung channel too weak, and your skin problem will be more severe. Okay, so he used this way is to try to enforce the lung channel. Okay, this give you so in tongue acupuncture. If you read one book, one point, they have a spleen. They have a spleen, and they have a liver. Okay, these 2 organs. You know, actually, this always treat the disease is between these 2 fight each other, disharmony each other. Now you know this way is different. Okay. Liver pulse is a deficiency, and fourthly is with the winter cold. See, all these 5 is deficiency. Fourthly is okay. See, so tongue acupuncture is more focused on how to support your 正气, how to protect your original qi, get coverage your 5 zang qi. Then, if your 5 zang is in harmony, no disease can invade to your body. Okay. 4 horse group. Okay, this treatment. Okay, this it's a proptosis, facial black spot. Oh, this is a female like this one. Okay, the pimple, red eyes, stuffy nose. Okay, overeating. Sometimes you can use this one. Okay. But I never treat the patient with overeating use this point. But my one disciple in Argentina, he used this one, treat this one. He says it's good. Okay, and this is Dr. Zhai. He will go to Spanish this November teaching there. Okay. Master tongue clinical cases. Okay. Okay, it's same thing. It's very similar to the one cases is for the liver channel, right? The same thing here saying could not raise his hand. Martin said the root cause is cold, evil, invading the lung. So he used this use here, use this 3-pointer and add a kidney, open kidney. Okay. So you know. Okay. So the formal cases say the problem is in liver. So insert needle to upper straight yellow to treat the arm cannot raise. And this one because it's a lung use this point. So this is a master tongue use a lot continue to treat. Okay. A soldier was right mouth problem needle the 4 horses group. Martin said when there is a lung system disease, adding open kidney will increase the treatment efficiency. This is what we call reduce the south fire. Okay, reinforce the north. This is 1975 the difficult use this one. You use this way. It's actually in Chinese medicine. Okay, you know. In here, give you idea very quick. Okay, You know, 1, 2, 3, 4, 5, 6, 7, 9, 10. Okay, 1 and 6 belong to what? 1 and 6. 1, 6 is which kidney? It's a kidney. Water, right? In Chinese, we say in Yi Jing say 1 6 is a water. 2 7 fire. 3 6 wood. 4 no. 3 8 wood. 4 9 4 9 is metal. 5 and 10. 5 and 10 is earth. So let's say they have a 3 5. Earth is a 5. Earth is a 5, and the wood is 3. Fire is 2. 5. Okay, metal. Okay, metal in here is what? It says 4. And the 1, water is 1. Another 5. 3, 5. If you do a Chinese meditation, okay, always use this thinking way. So we say the Jing Shui and the metal and the water is one group. Okay, wood and the fire is a one group. And in the middle is earth, it's a 5. Okay, so we say it's a wood and the fire always down or up. Up. Upward is a downward. Okay, so they are different. It's a 3 group, 3 5 group. So it's different. I don't know. 请问你们从中国哪里来？你们两位是从哪里来？ Are you Chinese? 啊？ Oh, okay. So in Henan there's in the Henan the province, Henan 中医药学院, the address is Metal Water Street. They like use the 金水路 use 金水路来 to describe the medical school. Okay, this one only give you the idea. So in Chinese medicine, sometimes the fire is go up. This one is go this way. Then the 金水 is go downward. Okay. Now we have no time to translate to see this theory. Just give you idea. This group different. Okay. So if the patient has too much fire, okay, you want to decrease the fire, and if you use metal, you can add the water. And at the same time, is try to supplementary in here and try to the fire and down the fire. Okay, it's a 泻 in here, 补 in here, reinforce in here. Okay, and here is like a purge the fire. So this is Chinese. If you want to more deep to understand the Chinese medicine, what they use herb, everything. Sometimes you need to understand this is 3 5. Okay, and the 5 earth is in the middle is very important. So sometimes we treat some cycle problem. Chinese medicine treat the cycle problem always treat where? Here. Because in Chinese say that your heart fire should go downward, right? And your kidney water should go up. But if here blocking here, and the fire cannot go down, water cannot go up, so they continuous fire in the upper and here. It's the same thing. It's very easy to see some patients have cold feet, but very hard the chest in here. The same thing like this way. That is, you have to treat the middle. Okay, the cancer sometimes like this way. Okay, so we just try to help the middle. Okay. Okay. Kidney disharmony is a kidney pathomechanism. Okay, all disease with cold causing contracting and pulling in kidney. Okay. So cold condition sometimes go to here. And actually, we can give you the idea is the one is 77.70, okay? 77.19 and 77.21. They're still here 77.18, okay? This is for kidney condition, okay? Kidney too cold condition. Use these 3 points. So the pulse is left tri deficiency and phosphatase. The 5 sound and 77.7 is the kidney is 6th channel, hard branch, okay? And 19 is the kidney channel. And 21 is the kidney branch channel. And 77.18 kidney gate is the 6th channel. 6th, that is the spring, that is earth. Why in here, but the name is, in Chinese name is Sheng Guan, it's a kidney gate. But why 6th? It's very easy. Use the earth to control the water. Use the earth, this gate, to control water is how much you should flow to where. Use this one. Try to keep the water circulation, keep the water metabolism. That is Sheng Guan. So the name is kidney gate, but belong to the 6th. Use the fu like to control the water the movement. Okay. So sometimes it's not water not enough. It's because you need to adjust the water. For example, another one, you know diabetes, right? Diabetes, the first one we don't discuss. The second one. Second one, sometimes we just give the what the medical doctor give the injection. Insulin, right? Insulin, okay. And they give insulin treatment. But some diabetes is not insulin problem. It's what? It's sugar, no. Sugar metabolism has problem. It's not the insulin the problem. It's actually you cannot the sugar metabolism failed. So some Chinese herb can treat the diabetes. Is treat the sugar metabolism no good. Like they have a 降糖灵，因为中药 do you know they call it 降糖灵. It decrease the sugar, very good one. The look like translate look like name 降糖灵. Its work is because they can adjust the sugar metabolism. It's not only use insulin. Some patients use insulin cannot get a good result. And there's another study say most HR people in USA, if they have diabetes, it's not insulin problem. It's because pressure. Because work pressure causes the diabetes. So your treatment is different. Not only use the insulin medicine cannot help the patient. Okay. So like a patient like this way, use acupuncture, use 3 lower emperors is very good. It's very good. Okay. Okay. Now this indication. Okay. And it's one is the heaven emperor. Okay. Hyper acidity. Okay. Nausea, nephritis, diabetes. Right. Diabetes mellitus and the albumin. Okay. Add heart disease, hypertension, dizzy due to heart disease, arm pain, and insomnia. Okay. 7.19 is different. It's because the most important is this word, kidney depletion. Kidney depletion. And the same thing, and the human emperor, the most important kidney depletion. So 3 low emperors sometimes is a two way. One way, if you more focus on kidney depletion, you use the 77.18, 19, 21. You use the 77, 18, 19, 21. If more close to the spleen condition, okay, you use 7, 7, 17, 19, 21. It's a little different, okay? It's a sciatica low back pain due to kidney depletion. See in here, okay? Just give you an idea. So I don't want to give you one indication one by one, give you an answer, but I want to give you an idea. If you understand that, you focus on, you can diagnose the problem is kidney depletion. So you use this point, okay? So any disease, if not indication not in here, but you can diagnose it not is kidney depletion, maybe you can use this one treatment, okay? I like to use this 77.18, 19, 21 to treat the diabetes. It's very good. Some patient can decrease the dosage of the medication. Can decrease the dosage. Okay, I have a case. Okay.
For lower back pain, would you do the same side as the pain?
If depletion, if a kidney depletion, I use the point in
Right,
here.
right. But if they have lower back and it's on one side, would you do the same side, that side?
Yeah, you can do the opposite. Okay, it's okay. Or you want to do the both sides, no problem. Okay, both sides, no problem. You can palpate. They will give you idea. I recently have one patient, then he has low back pain. He did a gardening work and hurt. Okay, but actually, she's a cancer patient. She usually have cancer. So actually, he hurt his low back about his kidney depletion. I use the 77.18 to treat her. Every day, continue for the 8 treatment. Now he's back to work, okay? Okay, we show. This one, I used to insert needle, the kidney gate, 77.18 to myself. I put one picture as a 3-inch needle, a 3-寸needle inside to myself, but not show for him, okay? We only use the 3. You excited at 3? You want 3?
Maybe not.
Maybe not. Okay. 我有，不要了啦，你好了。
Okay.
你现在饿不饿 ？Do you feel hungry?
I'm okay.
Okay. Okay, I insert needle. If you're feeling too sore, too aching, tell me.
Okay.
I stop. Okay. In here, this one is same thing. The point is between the bone and muscle. You try to find a groove or crease between there. Okay. Okay, I use this needle. This needle is Anchi, A-N-C-H-I, 2 words, and Qi, that's a flag, okay? This brand needle is Masterton use this brand needle. But the original owner already transferred to another people, okay? Now it's not the same owner, okay? But if I back to Taiwan, I still go to there buy the needle, okay? Masterton use this needle, okay?
Why do you like that one more compared to other needles?
Memorize the Masterton.
Oh.
And this owner's son used to be my student in one medical technical school. Okay. Okay. Now here is 7. Now this is 7.17. Okay, just between the knee bone and the fibula and the tibia bone in here. Okay. Now this one, then we go to a little down, maybe 1.5. You can feel in a tender point. Do you feel tender, right? You should feel tender. Because I watch your eyes. Okay. Then you insert needle. If you want to kidney deficiency or depletion, okay, your needle tip is go to the bladder, okay. So I because I just show you, okay. So I go to here, The pointer, here's the bone. I pull the muscle. Why? When I pull the muscle, I insert needle and the muscle bounce back and just push the needle, go to the bone. This needle is too long. Hurt?
Yeah.
Very hurt.
Oh, there it is.
Yeah, all the way. Okay, just this way. Okay, because this one is too strong. Okay, so I just give you idea. Just like this way, you go. It's okay.
You
Okay.
always have the needle that deep.
Not always. I give you idea. Some patient you can go to this so deep.
Like strong patient.
Yeah. Sometimes if the condition you need. Okay. Yeah. Condition you need this one. Then you pull out the needle. It's a very be careful. You need a little twist. Okay.
And what is that happen?
It's okay.
Yeah, it's,
You're fainting.
I'm okay.
You okay? Okay. Just this way.
That was 77, 17?
717, 18. 77.18.
18.
Yeah, so 17 in here, 18 in here. Okay, I just find 18 here. Most of the female patients are work too hard patient here. Will you just so this is the kidney gate. Your energy is not enough. So it's very good. I have many patients. They come in. They just ask these two needles.
Really?
Yeah, just they take these two needles. Yeah, they like these two needles. After they feeling energy come back. Yeah.
How typical is it to go down here? As
Yeah.
far as the sensation?
That is nerve.
Right, right, is it?
It's a 77, 17 is spling 9, right? 17,
Yeah,
17.
yeah, 17.
So then 77, 19 is 1 tune down.
No,
What?
it's 18.
18.
One and a half tune down. 1.5 tune down. Yeah, 1.5 tune down. Okay.
So the first one
Okay.
is spling 9.
Same thing. The other point is same thing. If you want to treat the kidney condition, it's the oblique. The needle tip is go to the bladder area, bladder channel there. Okay. Or you just go to here. It's the normal use the spring condition is only go to this way. Okay.
What is FEN?
Fen. Five is a fen is a 1 fen is a 0.1 tun. Yeah, 0.1 tun. 1 fen is a 0.1 tun. Huh? If a patient need a long term, okay, stay here. Let him totally relax 45 minutes. Okay, I depend. I just give you an idea. Is if a patient if very exhausted, okay, you insert needle there, let the patient totally relax, or you just give us some acupuncture music. They have one. Do you know acupuncture music? That one. Yeah, it's come from Taiwan. Taiwan they have that one. Okay, or you can use the free anxiety music. It's one. Okay, it's all the Chinese music. Okay. And some patient will ask, okay, and no light, okay, close the window, and they can totally relax, okay.
I think that her question is, do you always use 45 minutes as the patient?
I like to use 45 minutes. I like to use 45 minutes.
What the condition, no matter what. Like if someone has a headache, you resolve the headache, then you would still even. I've seen this work really quick.
Okay, I give you one idea. In here, just give you one idea. Why master tongue like use 45 minutes? I give you an idea. It's not only the circulation is 28.8 minutes, right? The Dr. Yang said like this way. One circulation is one by circulation 28.8. Because the needle is a double directional needle. When you insert needle in there, why master tone didn't focus on the, you should use the 补 or 泻, reinforce or another way. Because the needle, if you insert needle in there, your body will automatically, if your body need 补, he will go to the 补 way, the direction. If you need is 泻, they will go to that way. So use let the body developed by itself. But it's dependent, do you have time to keep the patient 45 minutes? It's dependent on this way. Actually, it's dependent on this way. Okay, you so sometimes if you have many patients coming, you have no time, right? So 30 minutes is enough. 30 minutes is okay. But if my patient coming, because now I'm half retired, my most things is take care of my mom. My mom 95 years old. She still every week he want to one Big Mac and the fat meat. He like Hank. She like that one. She still eat a lot of fat every week, okay. And she's speaking in the second floor. You in the first floor you can hear very clear, very clear. Okay, so this is now I take care of her firstly. Okay, treat patient secondly, because my son already 40 years old. I don't need to take care of anybody. Okay, my wife can work. She's an accountant. Okay, so she don't need me. She doesn't need me. Okay, she has more money than I. Okay, because my salary all go to her pocket. So easily. So in me, I'm half retired. So I treat patient. I can give you 40. So always arrange one patient is 1 hour. Arrange one patient.
So she
Actually, I have 2 rooms, but I like every 1 hour only arrange one patient.
Her question is, if you stick needles in and the pain is gone already, do you still leave it in for 40 minutes or no?
Sometimes still put it in there.
It's better to leave
Because
it in.
I don't need to do any technique, manipulation technique. I still later develop.
Okay.
You know, sometimes the patient feeling pain gone, you withdraw needle, 30 minutes, he come back. Yeah, sometimes like this way. Yeah, sometimes like this way. So sometimes you need more time. Okay, let patient relax. Most important, the patient come to you, he can relax. You give him relax the circumstances. Okay, and most of the people now they work hard. They have They always say I have no time to take a rest. Okay, I have no time to anything, relax myself. They lie down in there 45 minutes, and he take a nap. What's happened after that? You know, if you take a nap, you're feeling body good, right? You insert needle and take a nap, what happened? Even better, just like this way. Sometimes just think about this one. So sometimes you treat the high level patient, okay? It's the same thing. Give them 1 hour. And no ring, no phone call, no everything. He can really relax 1 hour. He will back to everybody and say, oh, I'm a miracle acupuncturist. He give me, I'm totally relaxed. Just like this way. Think about, sometimes we say we treat patient, not treat the body, we treat the spirit. Yeah, right? Acupuncture treat the spirit firstly, right? It's like this way. Yeah.
In what circumstance do you put the needle in and pull out right away?
Huh?
In the beginning, you said when Master Tong was treating the president of Cambodia, there are some points he push in and just take out.
Because
doesn't leave.
Okay, the first time he gave 20 minutes in the 3 layer, in the 3 lower emperors and open kidney, right? 20 minutes. Why? Because the patient in that time is still weak. The weak patient, sometimes you cannot keep it too long. You cannot keep it too long. You got 20 minutes, and after that, okay, water already give, then give a little metal, and give a little gel, okay? Look like a tube up, okay, just like this, tube up. Okay,
One more question about which side you do it.
both sides.
So always do both sides?
I usually do both sides, and I give you an idea, I still palpate where's the tender point. If I found only 2 points, I use a 2 point.
Okay, so bilateral.
Bilateral, it depends, I palpate. I'm not always using 6 needles.
Side, are you going to treat, if they only have like pain in their right leg,
Oh,
you're treating that, and I guess that's my question.
yeah, if you treat it's a joint problem, okay, it's a pain problem, it's opposite. Opposite, yeah. Mostly it's opposite, okay. You see, sometimes still the same side. For example, here, we will mention here the treated arm pain, just the same side. Just the same side, okay. It's still dependent condition, okay. 我们时间到了吗？还没有，不用，我可以不用。